Good evening, everyone. First of all, thanks a lot to the admins of this page, जिन्होंने हमें ये platform दिया है कि we can talk about COVID, corona-related topics. I'm very pleased कि आज we have two experts who have been working on the front lines in ICU here in Scotland, or I would like to discuss with them few aspects of PPE, or more importantly the N95 masks which I've been using, उसके challenges क्या हैं, वो सब चीजों के बारे में. Without taking much more time, let me introduce. We have Dr. Nandita Chinchankar and Dr. Umair Khan. Both of them are intensivists. What that means is basically they are taking care of the patients in the ICU. And they do have good experience at hand to talk about these things, first-hand experience. So starting with you, Nandita ji, सुनने में जो आ रहा है कि जो स्कॉटलैंड में जब N95 मास्क लगाने शुरू किए तो उससे पहले सब लोगों को ट्रेनिंग दी गई, उनके जो फेस पे थे वो मास्क फिट करके देखे गए, एंड देन जस्ट टू सी इफ दे आर नॉट नथिंग इज लीकिंग इन एंड ऑल दैट. Or what I am gathering is that back home in India, it's like a one size fit all mask which is being handed over, which doesn't mean that it's entirely wrong. But are there any risks? Are there any dangers in using that mask without getting a training beforehand? And if you could, compare both the situations for us.
Yeah. So thank you, Aviral. Yeah, that is entirely true. So before the pandemic came in full force to the UK, we were all face fitted for the masks, because one mask doesn't necessarily fit all sort of faces, because faces are different shapes and sizes. And actually it was quite a labor intensive fitting procedure. Took approximately up to an hour. एक घंटा लिया उसने. But say there might, if there's a place that they've just got one mask and they've got to try and fit it to all their doctors, then there could be some things that we can use to make sure that the mask is fitting us well. So you put the mask on, make sure that all the elastics are tight, and just breathe out through the mask. Make sure that air doesn't escape from anywhere around the face. Another good test is wear your goggles or wear spectacles, and then blow out, because if there's misting of the glasses or the goggles, that certainly means that there is a leak. Okay, because your leak is going to be either at your nose end or at your chin end. So those things are important. The other thing that what they could do is, if you got some deodorant or an air freshener, just spray it in the room, and if you're wearing the mask and it's fitting you well, you shouldn't really be able to smell the deodorant. But if you can smell it, then there is a leak somewhere, and then either you have to try and see whether there's something else that you can use, or try and see if you need to change the mask. Along with a well-fitting mask, the other important things are to wear a theatre hat, to wear goggles for eye protection, and also to wear a full face visor. That's just like a plastic sheet with a band. एक band ऊपर है, plastic sheet, वो पूरा face को cover करता है. So that will
protect करेगा.
हाँ, that will also protect the mask. So ये सब important है.
जी, thank you very much. Dr. Khan, Umair साहब, if I could ask you how many, if you can give us in some numbers, के जो hospital में आप काम कर रहे हैं उसमें आपके आईसीयू में कितने बेड्स हैं, और मान लीजिए कि अगर वो पूरे के पूरे बेड्स फुल रन कर रहे हो, फुल कैपेसिटी, तो आपको एक दिन में कितने मास्क चाहिए हो सकते हैं नर्सेस के लिए, डॉक्टर्स के लिए, जस्ट टू गिव एन आइडिया कि वो नंबर्स क्या हो सकते हैं.
जी, तो as Nandita has said, there's a lot of planning that goes into this kind of a situation. That it's happened in China, it's happened in Italy, so you have a forewarning, and that's what the preparation involves. So as you've said, we have these figures of 18 beds. We know how many ventilators are needed. We need to know that the ventilators are all working fine. We have replacements. Same with the mask. Nandita has said much before we were expecting patients, all of us got fitted with masks. And the number of masks that we need, that was calculated so that we knew that we had a regular supply of that. So we have 18 beds in
जी.
our pediatric intensive care unit. And like you said, if this was running to full capacity, which thankfully it's not,
Mhm.
then it's about, I would say, 150 masks for the unit.
Right.
And that might just seem a lot of masks, but you have to realize that each intensive care bed would need a nurse with that patient.
Right.
With these tight fitting masks, it's very difficult to wear that for a long time.
Sure.
So what I would say is, if you're going in 4 hours, you're wearing that mask, tight fitting mask. You've seen those photographs of the poor nurses coming out with big bruises on the face. तो ये सब सोच के ये हुआ कि फिर एक नर्स 4 घंटे से ज्यादा एक बेड के साथ नहीं रह सकती. She has to come back, take a break. So if you can imagine, if you can add on all those numbers, each bed for a nurse on the bed will need about 10 masks to cover the full 24 hours.
Right.
You multiply that with 18 beds,
18
then you
beds,
have the
right.
doctors going in, you have the physiotherapists, you have people who need to change the position of the patient. So for us, ICU in Scotland, I would say we need roughly about 150
Right.
masks a day.
So for an ICU of 18 beds, masks for nurses, for doctors, for support staff, for 24 hours. When you're running full capacity, is roughly around 150, which is indeed a big number.
And
But
we're
yes,
saying we're not reusing these masks at the moment.
so जब करना है तो करना है तो करना है. That's what it is needed. And as Nandita mentioned earlier, it is for the protection of the healthcare workers, which is why these things are very important, so that they can be protected and they can go on treating patients. Nandita ji, if you could please take us through the process कि मान लीजिए emergency में suspected COVID positive patient आया जिसको ICU में आना है intubation के लिए, तो what are the steps, what are the precautions जो लिए जाते हैं all the way up to के ICU में procedures हो रहे हैं?
तो if the patient has to come through or come to ICU, the patient is obviously going to be needing some kind of oxygen क्योंकि वो ICU को breathing support के लिए आ रहे हैं. Then what we would do is we would put a sort of a oxygen mask on the patient, but also on top of the oxygen mask put a surgical face mask, or put a surgical face mask on the patient's face and then put an oxygen mask on top of it. So either or, just in case क्योंकि वो अगर खांसेगा तो there shouldn't be generation of these
aerosols.
And so there shouldn't be sort of an aerosol which will contaminate the bed and the healthcare staff. So we would make sure that the patient is wearing the surgical mask, and all the people who are accompanying the patient also are wearing a surgical mask, are some eye protection. They've got visors on,
right?
So sort of covering their face, and they're wearing some kind of plastic gowns, and they also are wearing disposable gloves. So itna to protection chahiye healthcare. And then they come into the ICU. What we pretty much all the ICUs have done is they've got a red area which got all the COVID patients or suspected COVID patients, and a green area which has got the other ICU patients.
Sure.
So pandemic hai, other ICU patients still keep coming. So you've got to make sure that you keep them safe. And what we've done is try to give them two separate entrances so that there's of the patients. So make sure that there is different door for the COVID positive patients and a different door for the other ICU patients. So there is no coordination. The other thing that it might be something to consider is agar lift se patient upar aa raha hai, so try and see if there is a dedicated lift that you can give. If the hospital has got lots of COVID positive patients, maybe they need to be a dedicated lift rather than bringing the same different patients through the same lift, because then you'll get
exposure risk.
Exposure.
जी.
और जब वो पेशेंट आता है ICU में, The most important thing to do is actually preparation and planning, because you want to spend minimum time with the actual procedure. You want to make sure that all the preparation, everything happens outside the room. Because once you're wearing all the protection, all the PPE, it becomes very difficult to speak to everybody in the team.
So by preparation, you mean, sorry to interrupt, by preparation, you mean who is going to do what, who is going to help where, who is going to intubate, कौन डालेगा? जी.
Yeah. So, एक तो, as we know that this is a risky procedure, intubation यानी tube, breathing tube डालने का procedure. That's a risky procedure. It creates a lot of aerosol. So there is risk to the people who are in close proximity to the patient to get infected. So you want a minimum number of people in the room.
Right.
So you need maybe at least 3 people in the room with the patient, because each has got a specific job to do, and maybe 1 person outside as a runner in case kuch, you forget something, so that you can indicate to the person and they'll be able to.
वो रनर भी फुल N95 वाले गियर में होगा या वो सर्जिकल मास्क वाले गियर में होगा?
तो प्रेफरेबली N95 में होगा, क्योंकि if you need something they will be able to get it in, but they don't need to wear it.
अच्छा.
They can have it ready. If you need to call them, they can wear the mask, and they can have everything else ready. They can have the surgical gown, gloves, बाकी तो सब pens के है. But अगर लगा, क्योंकि as we know the N95 mask, there is a shortage of that all the time, and they are quite a treasured commodity. So you don't waste them. So minimum number of people. The most important thing is actually prepare your equipment and your drugs outside the room.
Right.
Plan who's going to do what, as you said, and make sure each one in the team knows exactly what they're going to do, who's going to intubate, who's going to give the drugs, who's going to look at the monitor. Just make sure everybody knows what their exact role is. So then when you go into the room, it just happens very, very smoothly without any interruptions or without anything getting forgotten.
Right.
There are very good guidelines about how to prepare, plan, communicate, and the things to do inside the room, and how to do your checks afterwards, make sure everything has gone well. There are, so the Royal College of Anaesthetists, if उनके website पे बहुत अच्छा so the protocol दिया है, it's like a flow and very easy, like एक page पे सब.
तो अगर आप ये वाला इसका लिंक शेयर कर देंगे तो I'll put it along with the video, तो वो बहुत बढ़िया हो जाएगा. Right. ठीक है.
That's quite important. Yes.
Right. ठीक है. Thanks a lot for that. So it's clear that I think the key thing which I understand is that the transportation of the patient needs very well, protection of the staff who is doing it, and that protection can be the surgical mask care protection, or the key is the planning before getting into the ICU to intubate the patient. वो जो planning पहले वाली है, that is key, और उस planning में help करने के लिए we have these guidelines which we can share, and of course if anybody is interested to know more, they can definitely get in touch with us through various means. Umair Saab, coming back to you, because as we can imagine, this is a highly stressful situation. And as we can imagine, not everyone is used to working in that stressful situation by wearing the heavy, bulky masks and the whole system, the whole gear. I'm sure there must be added risks and there must be added challenges when you are working in that that situation with all the gear on. What are those risks, if you could let us know, or even simpler ones? What are those challenges? What are those difficulties the staff is facing? And if you can quickly highlight if there are some shortcut ways to mitigate them, to उनके कुछ solution अगर हैं जो आप use कर रहे हो तो बताइए please.
Yeah. So one, we've already highlighted about those pressure areas on the face, how tight the masks become, and that is why I would really hope that no person has to wear that mask for more than 4 hours at a time. So that would be one big problem with the masks. And on that similar theme, when you're wearing all that PPE, the protective equipment that Nandita was also saying about the gown, the visor, the hat, the goggles, the gloves, and the mask. Once you get into that, then you don't want to have to frequently come in and out of
जी
that room. So खासतौर से nurses का they have a checklist before going to into the room where they will make sure they are well hydrated. तो अच्छा अपना पानी, juice, tea, coffee. They have a meal. They'll certainly go to the toilet. So again, they don't need to come out for comfort breaks. So that's important. I mean, the nurses will do that instinctively. But it needs to be
लेकिन वो
highlighted.
चेकलिस्ट में
It needs to
है
be
वो डाल
highlighted that
बिल्कुल
there's a lot of respect within the team because we know that they're doing this. They're going into this situation where they're going to be there for 4-6 hours. So a lot of mutual respect there needs to happen. The other difficulty, and Nandita briefly mentioned that with the intubation scenario or a resuscitation, sometimes patients need resuscitation if they've collapsed. So if a team is there in the room wearing that kind of almost space suit like what we've seen, as a lot of people would have seen the photographs, communication becomes very difficult. A lot of communication in these stressful situations is from visual cues. You look at a patient's face, you look where they're seeing, you can understand what they want. But that's not going to be possible in these suits. So communication in this scenario, what we've started doing is have whiteboards in the room.
Right.
One doctor, if he wants to get anything done, he can write on that board. The other doctors have a good visual inspection of that board. The other thing is names. You don't know the person behind the mask, so have those names clearly written on the front and back of your gown. Some units have started having photographs on the outside or just underneath the gown so people know what person is there.
Right.
So yeah, I would say those are the kind of things. The other thing I quickly highlight is we've done this as a drill before we started seeing patients.
Right.
So everybody's got used to now how to communicate within that resuscitation scenario. So that use of the whiteboard I was saying and the names on the front, that came out through a scenario. So I would suggest that every team, while they have the time, if they can do a mock session, that would be useful to function as a team.
जी एक बड़ा क्वेश्चन काफी उभर के आता है कि जो मेल मेंबर्स होते हैं, चाहे नर्सेज हों, चाहे कोई भी हों, डॉक्टर्स हों, आजकल दाढ़ी का बहुत फैशन है, उनकी दाढ़ी होती है. सम हैव इट फॉर द फैशन पॉइंट ऑफ व्यू, सम हैव इट बिकॉज ऑफ रिलीजियस रीजंस. तो फेशियल हेयर को रखना अलाउड है, हटाना चाहिए, उसके पीछे क्या रैशनल है? Whoever wants to take it, I don't know, Umair.
So can I just say, because it might be there might be some religious sensitivities to this question, and certainly I've faced that as well. I have resolved that by removing my beard, because even in the UK there is talk of more research going into trying to provide masks which can fit with the beards, people with beards, without having to shave the beard, but that's not happened yet. And what we have to remember is this is more important than some religious considerations. Important for yourself, important for the staff that's working around you, and for the patients. So keeping all that together, I would say remove the beard, whatever, and I'm sure that is not a very difficult thing to do.
I had a good growth too, I must admit, and मैंने भी clean shave किया है इसके लिए. But I think to add to that, I think we also owe it to our families, because patient, doctors or nurses, everyone working in that atmosphere, और पूरे 100% protection precautions ना लें, तो we are also exposing families जब हम वापस आते हैं या बाद में, या हमें भी कुछ होता है, तो that risk is always there. जी, I think if I'm just looking at my notes, I think we have covered majority of the things which I wanted to at least today. और अगर कुछ और questions किसी के आते हैं, कुछ अपने colleagues India से, यहाँ से, बाहर से, कहीं से भी मिलते हैं, तो I think we will be more than happy to address those things. Another thing I just want to mention, which I should have in the beginning, was कि ये जो information है, ये सारी information हम इसलिए share करने की कोशिश कर रहे हैं कि हमें भी ये मिली है कहीं से. दूसरों के एक्सपीरियंस से मिली है, इटली, चाइना, यूएसए, हमें रेगुलरली इंफॉर्मेशन आती जा रही है, एंड वी आर प्रैक्टिसिंग इट इन our daily practice. So we think that we can spread it further, discuss it further, so that anybody out there listening, managing to understand what we are saying, can hopefully either adapt it or use it, and hopefully make use of it, and save themselves. The prime importance is save yourself from the COVID infection so that you can work for longer, and help the patients. That's the key. Thank you very much, Nandita. Thank you very much, Umar. And I'm hopeful that we are going to trouble you again with more questions. Thank you very much.
Thank you.